Hi, Dr. Keaten at Mainely Veterinary Dentistry, and we're going to demonstrate how we go about cleaning teeth here at the practice. So one really important aspect of this is good ergonomics, because we do this a lot, and so we want to save our bodies so we keep doing this for a while. So ways that we do this well is, one, we have these saddle stools that we can adjust the height, and we want to have our feet resting flat on the floor and have this angle. We don't want our seat too low because then we're going to be crushing our pelvis. So we want to take off some of that weight on our feet with this angle. We want to sit up straight, and using our loops for magnification will allow us to sit up straighter so that we can magnify our teeth and see through the loops. And then the last thing is having our elbows at 90 degrees to the table. So our tables also go up and down, so we can adjust that height so that our elbows are about 90 degrees for good ergonomics. So then when we go to clean our teeth, we want to utilize our modified pencil grip. So we can utilize at least our pinky finger, if not also our ring finger, to be stabilized on our patient so that we have good control of our scaler and can move around quickly. So the way I clean teeth is I start with the maxilla, and I'm going to go around each tooth, focusing especially at the gum line and just under the gum line, because this is where pathology happens. We want to clean every single tooth, all the surfaces, but making sure we get very well at that gum surface where the pathology happens. And so we don't want to spend any more than 10, 20 seconds on a tooth. So we're going to keep moving around, and we're going to clean both the outside and inside of every tooth, moving around efficiently and effectively, all the way around the maxilla here, okay? And then if we need to go back to do another round, we can do that. Then we move on to our mandible, and again, cleaning every surface. If we need to raise our table for this, we can. And cleaning around every surface with our short modified pencil grip and being balanced on our patient. Another way some technicians like to do this as well, especially if we want that fluid to run out of the patient's mouth a little bit better, is we can go from side to side. So we do our patients in dorsal recumbency, and then we can tip them, their front end, from side to side very easily. So we can clean the outside surface of this side with our modified pencil grip, and then the inside surface of this side with our modified pencil grip, moving from tooth to tooth. And then we can kind of just flip the front end of our patient around and clean the outside surface of this side and the inside surface of this side. And then once you're happy, everything's clean, we polish every tooth. So we're going to switch to our polisher head. We want to make sure our pedal is pushed to the floor, pedal to the metal, pushing hard down on our pedal. And we want to, again, modified pencil grip so we have good control, and pushing down on that tooth. We want that cup to splay outwards so that we're getting a good polish on those teeth to get rid of any of those micro abrasions that we caused with scaling. Make sure that tooth is nice and smooth and polished so that tartar doesn't continue to want to stick to those rough surfaces. All the way around, just like we did with our cleaning, and making sure we cover every single tooth. So that's how we go about cleaning teeth here at Mainely Veterinary Dentistry. If you want to learn more, you can go to our website at mainlyvetdentistry.com.